There's huge benefits, I think, to generative AI in healthcare. I think it touches upon a lot of the pain points that we just discussed, but also on a broader level. One thing that I heard recently was somebody saying the value of AI isn't making machines more human, it's in making humans more human. And I really liked that. It resonated with me a lot because I think, overwhelmingly across healthcare, we're overwhelmed. We're overwhelmed and burnt out. And a lot of that is with things that aren't even related to our clinical jobs, right? Administrative tasks and just the explosion of knowledge that we can't keep up with. So I guess I kind of think about it in terms of impacting specific sectors of healthcare. For example, from the clinical administrative support, I think we're starting to see already, the concept of generative AI being able to provide automated clinical documentation, generation of clinical notes. I've already heard of things like Suki Assistant, Corti, all these solutions for really assisting with those tasks. I see all the time on my different physician groups, screenshots of people just saying like, oh, I went to the doctor, I waited forever, and then they stared at the computer the whole time. They didn't even look at me in the face. There's no human contact. They're so late. And I hear this over and over again, and I'm hearing this in physician groups. So just imagine outside of those physician groups, the average healthcare visit and not being able to connect. So again, back to connection, I think that's really important. And then with that, the EHR is just full of redundancies, full of errors in those redundancies. I can't tell you how many times as a radiologist, you go in, look for, the relevant clinical history, and you're bombarded by these repeated templates of, the same errors over and over, he, she, all sorts of errors that, don't even really correspond and are not really relevant to us. So how much time do we waste doing that? I think there's potential for, all the meetings that we're doing now, especially post-COVID. I think we do many more, virtual meetings, but meeting agendas, we can summarize those, really pull out salient points. I think there's a lot of potential there. Um, the next sector I would say is clinical decision support. I think this is the one that sometimes the public thinks of the most, like diagnosis, prognosis. Everyone thinks that, of course, that we're just going to be able to replicate our jobs. And I think that's still a ways off, but I do think that there are a lot of things that are now augmenting our ability as clinicians to do our job and do our job well. I think outside of radiology, pathology, for example, we have a lot of parallel developments. We're both image-based specialties, and there are now platforms which can analyze those tissue slides and those complex patterns that may not be as apparent to us. But probably one of the things that excites me the most, honestly, is patient-centric solutions. I am very passionate about patient engagement, patient communication, patient education, and ultimately patient empowerment. So that's probably the area, especially as a breast radiologist, where I get the most excited about. I strongly believe that patients should be in more control of their healthcare. And so again, a lot of posts, people love to throw screenshots up of radiology reports, for example, and they have no idea what it means. And again, often this is in educated physician groups where physicians don't know what we're talking about. So if physicians don't know what we're talking about and they've gone through all of medical training, then again, how will the average person, non-physician, know what we're discussing? So I think we need solutions where not only, we have these reports, but these different areas of patient communication will understand reporting better. Those are kind of the big ones that come to mind. There's also, I think, research and development. Each of these things, I think, could be a whole webinar on their own, right?